Environmental factors, including life experiences and stress, contribute significantly to the risk of developing schizophrenia. These elements intertwine with genetic predispositions in a nuanced and complex manner. Schizophrenia is classified as a neurodevelopmental disorder, underscoring the critical roles of brain chemistry and function in its emergence. This classification highlights the essential biological foundations of the condition. Genetic factors substantially influence schizophrenia, with studies on twins revealing a 50% likelihood of developing the disorder if an identical twin is affected. This statistic points to the significant role of hereditary influences in mental health. Substance-induced psychosis can arise from specific drugs, manifesting symptoms similar to schizophrenia. This overlap complicates our understanding of the interplay between drug use and mental health. Particularly concerning is cannabis use during adolescence, which increases the risk of developing schizophrenia later in life by 4 to 6 times, primarily due to its effects on the brain's dopamine system. Additionally, hallucinogens and amphetamines can trigger psychosis, potentially having lasting effects on individuals who are genetically predisposed, thereby complicating the diagnostic landscape of schizophrenia. The two-hit hypothesis posits that a combination of genetic predisposition and environmental stressors, such as trauma, can culminate in psychosis, especially when intersected with substance use. This concept is crucial for understanding mental health vulnerabilities. Moreover, the long-term consequences of drug use can result in severe mental health disorders, with some individuals never fully recovering. This reality emphasizes the importance of awareness regarding substance experimentation. It is imperative for parents to be informed about the specific risks associated with substance use in families that have a history of mental health disorders. This knowledge equips them to make informed decisions. Adverse childhood experiences, such as trauma and neglect, are well-documented factors that can elevate the risk of future psychosis and schizophrenia. Early intervention strategies can be pivotal in mitigating these risks. Seasonal affective patterns suggest that individuals born in winter or spring may have an increased risk of developing schizophrenia, potentially linked to prenatal exposure to viruses. Similarly, malnutrition during critical developmental stages has been correlated with a higher risk of schizophrenia. Historical evidence demonstrates that famine can lead to increased incidences of the disorder. The stigma surrounding schizophrenia often stems from fear and misunderstanding, perpetuating negative perceptions of those diagnosed with the condition. Education is essential for changing these misconceptions. Emergency responses to mental health crises can vary widely, highlighting the pressing need for awareness and appropriate interventions. Recognizing the symptoms of distress is vital for delivering timely assistance. Finally, addressing the stigma related to mental health disorders is crucial for fostering open discussions and support for those affected. Acknowledging that these conditions are treatable can cultivate a more compassionate society.